right, what happens in cases of emergent CAD, or when a patient is experiencing unstable angina? So we treat them emergently with MONA. So what is MONA? As discussed earlier, it consists of morphine, oxygen, nitroglycerin, and aspirin. So morphine works by decreasing the myocardial oxygen demand, right? It decreases demand or the workload of the heart. It decreases the pain. It helps with anxiety. And so this morphine is considered an opiate or a narcotic. So this is the drug of choice for myocardial pain. Now, when we're giving this medication, we need to keep an eye on the side effects. So pay attention to your blood pressure and respiratory rate, because morphine can decrease both the blood pressure and respiratory rate. So before giving this medication, we should probably evaluate the patient's blood pressure and their respiratory rate. Now, next is oxygen. So oxygen is a given. We're just giving supplemental oxygenation just to help with the oxygen supply. Nitrates or nitroglycerin, it causes vasodilation. So vasodilation is when the vessels open up, so it allows more blood flow. And so examples of this medication include nitrostat or nitroglycerin tablet sublingual. And side effects of this, it can decrease the blood pressure significantly, and patients can often complain of headaches. So please remember the side effects of nitrates. Now, last but not the least, we have aspirin. So in this case, although aspirin is considered a salicylate or an NSAID, this is in this case it's used as a platelet aggregation inhibitor. So this is the pharmacological class of aspirin in this specific case. So again, as a platelet aggregation inhibitor, it prevents our platelets from sticking together, and it prevents clots from either forming or getting bigger. So continued treatment. So if a patient continues to have chest pain, we can continue to give them morphine. And again, we can continue to also give them vasodilators such as nitrates. So we have your short acting, which is nitrostat sublingual, so nitroglycerin tablet sublingual. We also have the long acting nitrates. So these are pills. An example of this is your isosorbide mononitrate or IMDUR. So IMDUR is the brand name or trade name, and your isosorbide mononitrate is its generic. So please know the generics. And then we can also give them the topical form of nitrates, which is your transderm patch or nitrobid or nitroglycerin ointment. Now there are also sublingual sprays and continuous IV infusions. In addition, we can continue to give our patients platelet aggregation inhibitors in the form of aspirin. And in this case, we can also give them beta blockers, including atenolol, metoprolol, and propanolol. So knowing how beta blockers work, right? How beta adrenergic blockers work, we know that it can decrease the blood pressure and the heart rate. Therefore, we need to monitor the blood pressure, especially the heart rate, right? And so please check for the potential effects and side effects of the medications that you're giving. Now, other class of medication that we give for this type of patients are your calcium channel blockers. So example of those are your amlodipine, diltiazem, and for this specific medications, we need to monitor for the blood pressure and congestive heart failure symptoms. So edema, shortness of breath, weight gain, and all the stuff. So any signs and symptoms of worsening heart failure. Now, if for some reason, right, the conservative treatment doesn't work, or maybe the patient is really having severe symptoms that are not being relieved, we're really worried about the patient having a heart attack, another intervention would be a more invasive one, which is cardiac intervention, or also known as percutaneous coronary intervention or PCI. And if the PCI doesn't work, it can lead to surgery. So again, we need to treat CAD, because if CAD continues, it continues to cause coronary ischemia, and if we let it go on, it causes cell damage or death, leading to a myocardial infarction.